Keeping up with change in healthcare. We often hear from our healthcare clients that change keeps coming their way, imposed by others, and they cannot keep up with it. Therein lies the problem, trying to keep up with it. Many leaders would rather stay where they are, bury their head in the sand, and so reacting is the next best thing. In our vast experience of working with hundreds of healthcare leaders, we have identified best practices. Those who consistently outperform others on both fiscal and quality measures get ahead of change by focused thinking, reworking and reinventing their practice to specifically suit the clients based on the best available research. They develop the critical thinking of their leaders and emerging leaders and then look forward with creativity and innovation. These people enjoy and embrace the opportunities afforded in change. You can see this in all of their communication. Those who are consistently struggling with change reach into the past or search for the next best guess about what might happen based on technical consultants' views. It becomes a lot like looking into a crystal ball. Their results reflect that. Here are some of the things we have seen hospitals do to keep up with the changes in Medicare payment systems. Medicare was implemented in the mid-1960s when only slightly more than half of all retirees had health care coverage. Since it was started with a cost-plus payment system, facilities benefited by increasing and capturing all costs, and so costs went up. The focus was on tracking and capturing costs more than on providing excellent care. Patients stayed in the hospital for weeks. In the mid-1980s, in came DRGs, and everyone reacted. The trick here was to capture the right diagnosis and keep length of stays short. Coders became highly prized, patients were educated about the benefits of early discharge, and the relationships were built to allow for quicker discharge. Managed care snuck in there, resulting in two masters. Some were paying a DRG rate, some a per diem rate. The trick became in ensuring one standard of care while beating both masters. Now add in ACOs, HCAPs, core measures, and patient perception. Healthcare organizations are still working on the trick to maximizing reimbursement under the current and evolving structure. Of course, we all know that it's important to keep your eye on the changes so you don't shoot yourself in the foot and get appropriately reimbursed for the great care you are providing. However, we have seen that those organizations that are sustainable keep the care of the patients and the health of their communities in mind first. They willingly stay ahead of change based on these factors in combination with understanding advances in medicine, changing technology, along with fiscal pressures. This results in loyal patients and employees, financial stability, and quality care. Organizations are made up of a group of people. People can either be fearful of change or they work hard to develop in a way that will support the health and sustainability of the culture. When people resist change and the organization resists change, hiring some whose behavioral styles are more adaptive and will support growth and innovation will keep your organization moving forward. What might it mean to have people in your organization who possess these behaviors? We know that to most effectively remain sustainable in a changing environment, you need to hire for or develop the behavioral style that will look forward and focus on the right pieces of the puzzle rather than those who have the "it's always worked in the past" or "you go first" mentality. There are a number of profiles in the market that allow you to measure your capacities relative to these traits. We've used many of them and have identified and recommend one that is particularly relevant to healthcare. If you are a healthcare leader and are interested in your own level of willingness to change and on suggestions of how you can maximize these traits, we invite you to click on the link in the description box below this movie to learn more about your behavioral style and take a free copy of the profile that we most often recommend.